fazer no Brasil, como ajudar e poder pressionar o governo.
Sim.
Eu vou perguntar assim.
Perfeito. Ah, perfecto. Voy grabar. I just take and from the environment to another, and had a couple of, yeah, so it's been this kind of, because I married to a family. So actually, it's a married. Before. Yeah, and I was.
So
family planning around COP.
Are we all ready? Time to... Well, so now it's time to wrap up with Astrid Puentes Villano, our wonderful UN Special Rapporteur on the human rights to a clean, health, and sustainable environment. So we'll close this session with her, and that will be wonderful. Thank you so much for being here. It's yours. Yes.
Yes, please come forward. Mil gracias. Should I start, right? Because they're not. Yeah. So, I mean, there's so many things to do, and this is going to be the last panel that I'm going to be in. And we had some questions there, but I wanted to first of all highlight the importance of addressing clean air for a human rights perspective. And I guess that this is not a room where we have to convince people, because we know that, and it's about how we convince others and advance. The human right to a clean, healthy, and sustainable environment is recognized in 85% of constitutions. So 164 states already recognize the right to a healthy environment. And the right to life also and the right to health are recognized. But of course, the challenge is how to implement them. And so there are a few things that, at least from the mandate and from the legal perspective, and I wanted to go, and then I was distracted, but I wanted to go to the table for the conversation. The states have the obligation to protect, to respect, protect, and fulfill human rights. It is an obligation. And one of the things that we're seeing now with climate crisis and with air pollution is several cases, litigation cases, both nationally and internationally. And I wanted to highlight a couple of these cases. One is in the Inter-American system in La Oroya versus Peru. La Oroya is a city in the Andes where a smelter operated and continued operating for a century. And it was public and then private and then public. And 20 years of litigation concluded, the Inter-American Court on Human Rights concluded that the risk created in the city was, the state knew about the air pollution. The state didn't implement adequate measures. And because of the risk created for the health of the people, and mostly children and women, so they also analyzed the marginalized communities and the impact to marginalized communities, the state was internationally responsible for the human rights violation. And one of the key aspects in that decision, and actually Lily that just entered, sorry to put you in the spot, but she was one of the litigators of La Oroya also. So one of the key aspects for this case was that the Inter-American Court understood how impossible it was to prove the direct linkage between the illnesses that people were suffering and the pollution, because there was no epidemiological studies. There was actually a decision from a court in 2004 that obliged the state to do epidemiological studies that, as we know, and actually you know more than I do, it takes decades to do that, years to have adequate and solid data. But the state, even with the order from 2004, didn't do those studies. So at the Inter-American Court, the lack of information was part of the responsibility of the state. And fortunately, the court addressed that and concluded that in those kinds of cases where there is a massive and proved pollution that the state knew for decades, then and you can prove that a person is exposed to this risk, then the state is obliged to, and it's assumed that the illnesses that are linked to pollution are linked to this situation unless the state proves the contrary. So the court changed the burden of proof. The other case that I want to tell you about is the Land of Fire in Italy. And it's a very similar case. In La Oroya, it was a smelter. But then in Italy was a region where for decades, and it's also linked to mafias. And so a lot of toxic waste, but also other kinds of waste was brought there, either hidden or, and maybe a lot of you know about this case. You for sure, exactly. You will correct me if I say something that is not scientifically adequate. And a lot of this toxic waste was also burned. And so in this case, also after years of litigation, the European Court of Human Rights in January concluded that that Italy was internationally responsible for violating human rights. In this case, it's not under the human right to a healthy environment, not because there's no violation to that right, but because the European region does not recognize the right to a healthy environment. And I really hope that it's done and the Council of Europe is talking about that process. There's some states that are championing that and advancing that recognition, but unfortunately other states are blocking that. So I really, and that's one of the things that I'm working, of course, to have Europe to recognize the right to a healthy environment. But going back to this decision from Italy, it was very similar situation for La Oroya, basically a situation where there was a lot of data about the health impact of these situations and the lack of good management of waste. And the court also concluded that in that situation, there was no needed to prove the link between the illnesses and the impact on people. And so I think that these two cases are a good example of how the law is moving forward. But also, to me, it's a very big, huge bell about that, of course, data is important, but we cannot wait for data to act. The lack of data is and should never be an excuse not to act. And that is one of the key conclusions also from the Inter-American Court that I want to share with you. What the the European Court on Human Rights said is that in these situations where there is a lack of scientific certainty on specific measures that Italy should have done, but if there is a risk to the health of people, Italy should have used the precautionary principle and implement effective measures while other scientific data was highlighted or achieved. And so to me, I mean, and there's a lot of things, of course, around other cases, but to me, those two cases are key to highlight, first of all, the advancements that we're seeing, but also how useful it is to use the right to health and the link between health, the right to healthy environment and life. And also we were talking in a little bit before how we are interconnected. It's not about health and climate and environment. We have to work together. And I was so surprised and pleased to hear all of the examples from Brazil and Chile and the Philippines, the importance for coordinated work. And of course, the role for civil society to convince, to advance not only states to act, but in that act also to control and regulate and monitor adequately the businesses and stop the drivers of the contamination. So I will just stop there and thank you very much for this invitation. And it has been wonderful to meet you in the conference.
Thank you so much for coming. And I think thank you, everyone. Anything else we need to, let's move on and keep together and strong and like do our best wherever we are. We have different capacities. We are in different spaces, and every space there is something that we can do to try to get out of this mess that we are collectively in right now. Oh, and have a nice day. And then, please. Picture. And then if you want to receive the notes, register in the QR code there on the screen.